All right, we're recording. I got an interview with a very good friend of mine here, Hoffman, and um, we were having a great conversation the other day. We're also work associates, and I think this stuff that needs to be shared with the public. And so if you get some nuggets out of it, or it triggers something, or you find it's a benefit to you, or you need to reach out to us for further information, great. But Maud Hoffman is, she'll explain it, but she's a licensed massage therapist. She's very knowledgeable, and topics health related, and we're going to go into that in a second. But just introduce yourself, Maud, and tell them where you're located and how long you've been doing this, and you have a passion for it, obviously. So.
Okay, so my name is Maud Hoffman. I'm a licensed massage therapist for 20 years. I have lots of different training: neuromuscular massage, oncology massage, post-mastectomy, scar tissue work. I worked with hospice for 3 years as a volunteer massage therapist about 12 years ago. And I also have gone through a big medical event 3 years ago. I had a benign brain tumor, a skull-based meningioma. So I have that experience with me as well in my bag. So we can continue, Brian.
Yeah, now tell them about what you had, because we're about the same age, and you went through a real life shakeup, and then kind of, you don't have to go, I mean, just make a short version of it, but then even some of the nutrition and the product we talked about, how you benefited from that, would be a great place to start.
Okay. So I had, up until about 3 years ago, before I had this brain tumor diagnosis that came out of the blue, basically, I had some mild symptoms for 3 days, and I took myself to the ER, and I found out I had this skull-based brain tumor that required extensive neurosurgery. And up until that point, I was very athletic. I did open water swimming. I could pretty much do anything athletically without any limitations. I took my health for granted. I was pretty healthy in general, eating healthy and maintaining a good weight and everything. But after that surgery, it was probably one of the toughest things I've ever gone through. I've had other surgeries. I had C-sections, hysterectomy. I've had knee surgery, things like that. But this was an entirely different ball game. And nobody really told me ahead of time. I mean, the neurosurgeon, of course, discussed the surgery, and but they really never said, the recovery might be longer than 6 weeks because of your work, but nobody ever really gave me a good guideline for what was to happen. So after that surgery, I had a cerebrospinal fluid leak as a complication from surgery. So I had to lay still for 6 weeks without movement, except for going to the bathroom and eating, pretty much. After that, I started physical therapy. So I spent about 1.5 years in physical therapy, working on my balance, my vestibular health. I had some eye issues. I had some hearing issues with ringing in the ears. Had a lot of neuromuscular pain. The neurosurgeon said at my pre-op consult that, you're going to have some neuromuscular pain. And I said, well, I'm a massage therapist. I know how to figure this out. Well, this was a totally different thing. So I had a lot of pain afterwards, and 4 months ago, because I started working at Physical where Brian works 6 months ago, 4 months ago, I started using some supplementation that they use in the clinic, mainly OPC3, which is an anti-inflammatory supplement with different ingredients in it. And I also recently started using the Cannabicool roll-on, the CBD roll-on that they also have. So those have really helped me. The OPC3, the anti-inflammatory, took my ringing out of my ears, and taking that out, I was able to have better balance and better focus without having the ringing in my ears. And the CBD roll-on pretty much has helped me sleep better because it's reduced my neck spasms. I mean, I could talk about this for hours, but I'm not going to. So I'll let Brian have the microphone again.
Yeah, she has a lot more experience with, well, you researched that. And again, we're not plugging a product. I'm just saying, when she comes up to me and says, wow, I feel so much better. Because she had some, back in here, right? Whatever you were experiencing that was gone.
Yes.
Went off the product because you ran out, and you could notice it came back. And when you go, it's like she's been off and on these things. It's not like we're very well, not change the subject, I'm just trying to keep my thoughts here, is we're very selective of what we recommend to our clients and our patients, because our reputation is everything. We can't be just selling snake oil to people. So we have to fully understand it, try to ourselves, seen it in action before we would ever say anything about that. So that conversation leads into you. You were getting more involved with the cancer patients prior to you getting diagnosed with the illness. And you said you were in there, and then I told you about some people joining the group that are going through treatment or have had gone through treatment. And that took the conversation in another direction that you were already kind of there. So can we touch on how this can fill a void for those people?
Yeah, that's correct. I was having this conversation with Brian just in general. And what I felt after my brain surgery was that I saw the neurosurgeon for follow-up. I saw my primary for my follow-up because I was on wicked steroids. So that did a number on blood sugar, blood pressure, heart rate, all that stuff. I gained 50 pounds from the steroids. I saw the PT for physical therapy. But if you look at it as it was very segmented. So in between those, they did an awesome job. Each person that I worked with did a phenomenal job, but there's a huge void. That's what I called it, a void. It's like a gray area where you're kind of floating, and I'm sure other people can relate to this, that has had cancer. I didn't have cancer, but I had a benign brain tumor in the brain where it wasn't supposed to be. There's no space in the brain to have any additional tissue in there. I just strongly felt, I went to the neurosurgeon and I said, Dr. So-and-so, there's a big void out there. And he just looked at me, and I went to my primary and I said, there's a big void out there. And the PT even, I said, there's a big void. But nobody really, they don't know what to do because they're kind of trained in their own area. So I feel that this group for me, because I do swim, I ride a tricycle because I can't ride a bike. Because of the balance issues, but I can function, but I have not ventured into weight training yet. I'm taking the boxing for balance to get stronger, but I'm still in that void where I'm kind of intimidated, because before I could lift anything, I could do anything, plyometrics, whatever, but I'm very hesitant to go there because I feel like there is no support in that area. So that's where I feel Brian and his group comes in a perfect spot to fill that void.
Now, for the cancer, and again, I think there's a population of people that, whom, again, this is all kind of new to me because I haven't dealt with people in these situations before, but they want to now change their lifestyle, going through it so that doesn't recur, or other things do not recur. So filling that void, or that support and that education to put them on a healthier lifestyle. Not saying that an unhealthy lifestyle caused the cancer, but there's a high probability. It's not everyone, but just our lifestyles in general, with the American diets and the inflammation and the damage it causes the cells. So that's something I think we want to attract more of those into this group. And then again, you had some connections prior to, and we're going to reach out, but we also want to put it out like this. It's not just about weight loss, even though that's what a lot of people come for. It's total health and wellness and well-being. Weight loss to me is a byproduct of doing everything healthy anyways. So maybe take it in that direction with we're not convincing anybody. We're just letting them know that this.
Yeah, I think anybody, the people because like I said, I was doing quite a bit of oncology massage, which is, the definition is anybody that's has active cancer or undergoing chemotherapy or radiation. And that's what I had a lot of training in. And I think anybody that has gone, and me personally, like I said, I did not have cancer, but I know that those clients that I had a pretty substantial number of clients before brain tumor came along. But I feel that they had to fight so hard to maintain their quality of life. Even going through treatments, and if they have 2 years of chemo or radiation, it does a wicked number on the body. And I think, from what I've heard from clients, they feel that void. There's a huge void. It's like being out in the abyss, kind of floating around, because there is no, you have the physical therapist, like I said, you have the oncologist, you have their primary doctor, but there's still a void. you know, in what direction to go.
Yeah, so this is our opportunity to reach out and hold their hand through this, because going back to the same lifestyle is probably not a good idea. And I got another, again, they're showing up every day. One of the girls in our group at our physical location, but she's in this group now too. By the way, this group is called Fit Female Project. I didn't even tell you guys about that. It's so new. There's a private invite only group of people who are serious about putting themselves back on track. And we're not talking that you're just ill. We're talking overweight. You're feeling down, lethargic, sluggish. Everything you've tried does not work anymore to lose weight. More as your aging type female. When I say aging, it seems like 40 plus. The body has changed. It's been under so much stress. You've got to do things a little different than just do a diet and exercise. It's not going to work. There's a lot of women out there that are frustrated trying to do that. So you even said to me when, I have some people now starting that, be careful of what you recommend to make sure, obviously, if I do recommend a particular supplementation to support something, whatever, okay, just what I think is really good, the doctor has to sign off and approve of that. And as you were getting them sent to you, you had to do a lot of research, because in order to massage that person, you just can't dig in, right? I mean,
I have to, what I do if I have somebody who's undergoing, first of all, anybody that's undergoing radiation is contraindicated for deep tissue massage, and a lot of people don't know that. And the other thing is, with the chemotherapy, every chemotherapy drug is different. So what I do is I research the chemotherapy drug and any contraindications. I also have to have a blood count from the doctor, or a recent blood count, to see if the body can process the massage, because everything that happens in a massage session gets filtered through kidneys and liver. So if the body's blood count is very low, it's not prepared to receive the massage. And usually, my clients that used to come for the massage would come the day before chemotherapy to calm the nervous system to process that chemo better, but their blood count always had to be up. And people that are undergoing the treatment, they know what I'm talking about, and their doctor would have to sign off on it. So it's very specific. It's not just something that, come and get a massage when you're undergoing chemotherapy or radiation. So yes, there's a lot of training that goes into that.
Yeah, again, when we were having that conversation, that enlightened me, because I had no idea either. It shows a lot of people out there feel they have no clue. So, and that separates you, okay? And then even when we go back to kind of bouncing back and forth to the supplementation, we only recommend a product. I want people to understand this. If we feel there's an absolute need to help alleviate or assist in alleviating a situation. So you've been into other things before, like essential oils, but man, when you started telling me about the, I'm looking at it here, the thiaminol and the cannabiquin, I don't know anything other than, I don't know anything about it. All I know is CBD. And I didn't know there's hemp, there's a full spectrum.
Yeah, full spectrum hemp. Yeah, you got endocannabinoids, it's a huge thing. And then you got the black cumin seed, that's the thymoquin. That's also very beneficial.
And that's the one you're using, or both?
I'm using the OPC3, which is the pine bark and resveratrol and some other things in there. And then I'm using the thymoquin capsule form, which has the pine bark in it, and then the black cumin oil. And there's a lot of research that you can look up on black cumin seed oil, the benefits of it. And then I'm using the CBD roll-on. Those are the only three that I'm using.
And the roll-on, you said, gave you a longer lasting relief. You kind of explain what that does, because it does have.
What I do is I roll it on in the morning, and it has 4% lidocaine. It has the full spectrum hemp, and then it has the aloe in it. So it has a cooling effect. It's kind of mellow when you put it on, but for me, it lasts. I put it on in the morning and then at night before I go to bed, and that product is recommended. You could use it up to 3-4 times a day. But for me, it lasts all day. I am able to be at work and do my physical work as massage therapy without any residual pain. The OPC3 that I started taking took my pain away to about 50%. And this is probably to 0 now with adding the CBD. So I've kind of gradually added it. I have not gone crazy and bought everything, you know. I just kind of researched it on my own and listened to Brian a little bit. And the CBD is just kind of like icing on the cake, the roll on.
So you were having trouble sleeping throughout the night because of the pain in the neck.
Yeah, they cut the neck muscles, 3 major neck muscles from surgery. So I have a lot of scar tissue. They also peeled back the scalp without being gross here, but peeled it back quite a bit. And they have to do that to cut the bone to get into the brain. So I have a lot of scar tissue in my scalp, and this product I can roll into my hair and it just kind of melts in to my scalp. So I have no spasms at night anymore. I used to wake up every 1 to 2 hours to change head position.
Gosh, that makes it difficult, like you said, to perform daily activities, especially work activities.
Yeah.
You're getting that deep restorative sleep.
Yeah.
And that's one of the pillars or part of the 5-step system I'm teaching men and women is the quality sleep, of getting into that deep restorative. Even I was having an issue with it, and I won't go into detail, but that's an area